Doctors in Ohio are reporting a spike in pneumonia cases among children, similar but not linked to outbreaks spreading in China and parts of Europe. NBC medical contributor Dr. Narula is with us now. Dr. Narula, thanks for being with us. So what exactly is going on in Ohio, and should the rest of the country be concerned?
Right. So this is taking place in Warren County, Ohio, which is a little bit northeast of Cincinnati. And health officials there are reporting about 145 cases of pediatric pneumonia in kids ranging in age from 3 to 14 since August. They basically don't have any underlying cause yet for this, but they are saying that even though there are more cases, these cases are not necessarily more severe than what they see in typical years. There's been no deaths. Most of the kids have recovered with antibiotics and are at home.
It seems kind of unusual that there would be such a spike in this one little spot in the country. They have no idea why that's happening?
They have not identified a single underlying cause or etiology yet. They haven't identified a link between the cases. Most of the kids are average age of 8. It spans across multiple school districts. They are saying it does not appear to be linked to other outbreaks, either nationally or internationally. And so, you know, they also haven't identified, as I said, any particular pathogen, but when they have measured, taken specimens from the kids, they have seen adenovirus and mycoplasma pneumonia and strep pneumonia, some of the typical agents that we see causing pneumonia every year. And it's not unusual to see spikes or clusters happen at different time frames. And so, you know, it's important to understand that this is happening, but not to cause alarm at this point in time.
So what are some of the symptoms of a parent waking up with their kids right now this morning? What should they be looking for in pediatric pneumonia?
Right. So some of the symptoms can be nonspecific, but in general, you want to think about cough or fever. In younger kids, they may be fussy or lethargic, not eating appropriately or having a decrease in appetite. Also some abdominal pain, nausea, vomiting. If they say they have pain when they take a deep breath. And then certainly if you notice your kid is working harder to breathe, their lips or fingers are turning blue, they're not able to stay hydrated or keep in fluids, that's when you would want to call your doctor, even potentially take them to the hospital.
Okay, so what should you do if they do have some of those symptoms but not severe enough to warrant the hospital? What should a parent be doing here? So
certainly there are measures you can take at home, so fever reducers or pain reducers like Tylenol, cough medicine, humidifiers, keeping them hydrated with fluids. And then in many cases, if it is bacterial, they will be prescribed an antibiotic. For the viral pneumonias, there is no real antiviral treatment for that. But again, most of these kids recover and do well.
So bottom line, isolated for now to this area, but we'll keep an eye on it.
Correct. And then taking all the precautions that we talk about, covering your cough, hand washing, really important to remember before the holidays.
Getting your vaccines and all that.
And vaccines,
Dr. Narula, thanks so much.
Thank you.
Good to see you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.